Hi, my name is Taylor, and I'll be playing the role of the student clinician.
My name is Amanda. I will be the client with Apraxia.
And today we're going to be doing an oral mech exam. So initially, when I meet Amanda, I'm going to introduce the oral mech exam, and I'm going to assess her breathing and just kind of look at her chest to see the rise and falls and listen to see any audible breathing, which looks pretty normal. All right, and now I'm going to look at Amanda's facial symmetry. Everything looks pretty symmetrical. Okay. And then sometimes if you have a patient or a client who doesn't have facial symmetry, it's usually because they have a different dysarthria or aphasia that has the facial drooping and the hemiplegia in that side of the face. Okay, so next we're going to do is check the lips. I'm going to look at her lips at rest, and everything looks symmetrical. Now I'm going to have you pucker your lips like. Okay, and I'm going to have you smile. All right, and then go back and forth between the two. Okay, and as you can see, there's a little bit of delay in initiating that movement and a little bit of groping in the lips, and that's because of the motor planning. All right, now I'm going to check the strength of your lips. If you could pucker again. Okay, good. All right, so next we're going to look at the symmetry, range of movement, and strength of the tongue. So I'm going to have you stick out your tongue straight, okay, and if you can move it to the left. Okay, can you move your tongue to the right? All right, and now can you go back and forth like. Okay, good. So your range of movement is good. And now I'm going to check the strength of your tongue. So can you stick out your tongue straight? Okay, I'm going to press this again. So can you push back? Good. Now to the left. Try to reach it. Okay, and now to the right. Okay, good. So then her strength of your tongue is also normal. So next I'm going to ask you to put the tongue to the roof of your mouth. Like, good. Again with that range of movement. Okay. Okay, so next we're going to look at your oral cavity and your palates. So I'm going to check your teeth and then your hard palate and your soft palate. So open your mouth wide. Okay. No cavities. Everything looks good. Okay, now your hard palate, your soft palate. All right. Okay, next I'm going to do is I'm going to check your gag reflex, okay? So I'm going to push it far back and then we'll kind of see what happens, okay? Okay, so the gag reflex is intact, and that's showing that the involuntary movements are unaffected. Okay. Oh, now we're going to check a velar elevation. So I want you to open your mouth again, open wide. Keep that tongue in there. And I want you to say, ah, ah. Okay, good. Now you can look at me. I'm going to have you say, ooh, ooh. Okay, and now, ee, ee. Okay, great. So besides for the delay in the movement, the phonation is pretty normal. Okay, now we're going to do some sounds. I'm going to have you follow what I say, okay? So can you do pa, 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 Okay, good. Now we're going to do another sound. Can you do ta, 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 ta? Ta, ga. Okay. Then the last sound we're going to do is ka, 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 ka. Ka, ka, ga. Good, good. Now we're going to combine all sounds together. It's going to be pa, ta, ka, pa, ta, ka. Okay, you got it? Ta, pa, ta, ka. Okay, good. So as you can tell, there's a delay and a silent pause before initiating the sound, and also there's a lot of inconsistent errors. And that's all for oral mech today.